Yeah, and I would, I would probably make the offer to Bobby and to Sandy if it's Sandy. I mean, it would be ideal if Sandy could actually be the one to make the presentation coming from the district.
I'm off with that.
Yeah.
We have a request that I haven't sent out to everybody. One of the incoming incoming governors wants to come to our next board meeting.
Oh.
Well, yeah, that's what I thought. But
virtually?
Well, I can't remember who it is. I'll send it out to everybody here in a day.
Well, you know something, Cal? I bet we could just have a meeting just for him and doesn't have to be at our regular board meeting.
Yeah, I agree. And I really didn't want to do it on the May one because we have an awful lot of territory to cover on May. And, it's coming up to our year end. I'm almost with you. I'd almost rather set up, since it's virtual, maybe just agree to everybody come to a time and let the person come on and talk about it.
They probably did it in Frederick, but they kind of routinely used to do this, and they just go to dinner or go to breakfast or something.
Right. Well, I'll pass it on. It just came in within the last day or so. I'll pass it on to everybody. We can roll it around.
Cool.
Good morning, David. Barry.
Hey, good morning.
Hey, Jamie.
Jamie,
Jack is gorgeous.
But you didn't change it on this one. Let's see the picture of your fish, Jamie. You'll have to change your photo on this on your Ring Central.
The fish weren't anything to crow about. It was the variety which I was impressed with.
Well, when you can change that picture over, you changed it on the something else I saw you had on your email, not email, but text or something like that. I saw the picture. I liked it. That's nice looking fish. So share your victories with us.
Yeah. When I can, I guess.
Barry, we're okay on muting the mics. So just put everybody, get the word out now. And when Barry goes on, he'd like us all to mute our mics. Jamie's going to track everybody for conversations in the chat room. Then somebody's going to have to sit down with me and tell me how to work the chat room. I'm afraid if I touch something, I'm going to turn my computer off.
Just keep your hands up like this.
I know, that's when GPS was new, back a number of years ago, when Mary Jane and I were driving to Chicago, and we had the GPS set up to get exactly to our children's house. And we were about, just coming into the edges of Chicago, and Mary Jane reached over the phone and tapped the screen and said, "Look at that." And the whole thing went dead. And I could have navigated to Chicago as a blind man, but for the next 12 miles was really about 99% of all the navigating that we needed. So I had to pull over and reset the whole program so we could do that. So we have this program in our house too. Keep your hands away. We have a guest here. Let's see who is that? Barry. That's Barry's.
Him?
Oh, that he's in the hospital, or in the not the hospital, but the free clinic. This reminded me of something. You know what we haven't done is made a decision on the $500 for this quarter for the COVID relief contribution. If anybody's still interested in doing that, I'll bring that up as a topic. We've had some interesting discussions in the last couple of days, and those of you that are on now know that I've talked to David Akery, and he's a fairly strong maybe to take over the job as treasurer. Jamie knows about it, and he's agreed to help David. David knows how to do QuickBooks on his, for his family work. But I told him that the Rotary was nothing more than a larger family, and it's really not like commercial accounting or something like that. So I think he's okay with it.
Well, he's right in front of us.
Yeah, I'm talking to him. David, are you listening?
I'm listening.
It's a good.
I'm listening. Can you hear me?
Your ears should. I can hear you. Your ears should be on fire because we're talking about you.
I heard you.
Yeah, but just talking to. I talked to Jamie. Jamie's been very gracious to talk to you about QuickBooks and just to see where you feel your comfort level is with it at this point. And
And I,
to assure you that someone will be more than willing to work with you to get that up to stuff. But,
David, I just sent you a chat.
Okay.
So maybe we can discuss it offline, eh?
let's see, there's a chat.
Hi, Ray.
Hey, Ellen.
Superintendent Sneed.
Ooh.
Hey, good morning.
If he does that, now we have to call him Dr. today.
Yeah.
When he signs on as superintendent, now we have to refer to him as Dr. Sneedy.
The doctor in the house.
I don't know how that thing, it says something different every time I get on it. So
Dr. Sneed.
hope everyone's doing well.
Yeah. So there's a high school graduation Saturday. Is that what I hear?
Yes, we start one at 8 a.m. and the other one at 11 a.m.
And I heard only 2 people per graduate can be inside the fence.
6.
6.
Yes.
Okay.
Oh, boy.
And then people that are outside the family unit, can they just stand outside the fence or something?
Well, you know what I've learned? I can just control what I can control. So I'm sure there will be plenty. But I surmise that they will be, in all seriousness. Kind of like at some of our games.
Oh,
We're very excited though. No, what happened, Ellen, is we started out with 4 tickets per person, given the rules and the square footage.
mm-hmm.
And then when some of the guidance was eased, we went back and redid our math just as late as this weekend, right?
Mm-hmm.
And so yesterday afternoon, we believed that we could add 2 more per graduate to make it 6. So that's how we got to that. So in all fairness, we just were able to get to that number over the weekend.
Yeah. So is it outdoors at the athletic field?
It's at Porterfield. Yes.
Right, right. Okay,
Yes.
great.
And so we do our practice on Friday morning. So I'll get to get a little preview of how things are gonna look.
Okay.
But so we do A through LA. We do A through LA on at 8, and then the letters beyond the last names that start with beyond LA to Z at 11.
Okay, at 11 a.m. Okay.
Yes, ma'am. Mm-hmm. So that's one that's going to start getting warm. So,
Yeah.
Had 90s all year, but let's do it on Saturday. But it's everything's, it's all good. We find our blessings in what we do and keep moving.
Yeah.
Well, folks, we have a quorum, actually. It's a little bit after 8, so let's go ahead and start the meeting. We know a few can't come today. But if you'll allow me to begin with the Pledge of Allegiance and then the 4-way test. And I got Barry's cheat sheet this morning, but I already taped one to my computer so I could remember the 4-way test. But let's begin with the pledge. I pledge of allegiance
To the flag of the United States of
America, to the republic which stands,
One
Nation.
under God,
indivisible,
liberty
and justice for all.
for all.
And the 4-way test, is it the truth,
Truth is it
Is it fair to
all,
all?
shared all concerned, all
skill, goodwill, and better friendships?
will be beneficial to all concerned.
Well, good morning again, everybody. As has been our practice with these virtual meetings, we like to go immediately to the host or hostess of the meeting. In this case, it's Barry, and let them get started with their meeting. And then if we have some time afterwards, we can talk about the business of Rotary Club. Barry has requested that we all mute our mics, and you'll have to handle the rest for me, Barry. But Jamie's apparently going to referee the chat room and bring questions back to you somehow. So I don't know how that works, but I'm tagging along with everybody. So with that, Barry, good morning and welcome. And
Hey,
you're
good morning, everybody. I'm here at the free clinic, and I know we have a lot of new members, and I don't know how familiar everybody is with the clinic. I know every time I come, I always learn something, and I always leave out happier. And I hope that this will be very informative and fun. Today, I have two special guests. I'm going to flip my camera screen over here to pan in. Hopefully this is Doreen Brown. She's the executive secretary. She's been here since 2008. I think that adds up to 13 years. And then we also have over here Kim Fry Smith, and she is the, what?
Good morning.
Oh, good. She said good morning. And she is the resource development director here. And she will tell us all about what she does when we interview her a little bit later on. So I'm not sure how well, is everybody seeing a fairly full screen with the video? Give
Hey,
a
Barry.
thumbs up, Cal.
Barry,
Yeah.
try turning your phone sideways.
There we go.
Better.
Is that better?
Oh, yeah.
Okay, good. I'll do it sideways then. Okay. So we're here in the entranceway, and I'm going to let see somebody's barking dog there. Well, that must be Jamie. Say, hey, Ruby. So Doreen, would you first tell us a little bit about how the free clinic got started and a little bit of the history of the clinic?
Sure. We started back in 2006, actually, when the group of citizens got together here in the community, comprised of doctors and social services and other community organizations. And they decided that Orange needed a free clinic, something that to help patients or people that did not have health insurance and health care. So in 2006, they started talking about it. In 2007, in July of 2007, they opened the doors. And so we've been open for 14 years now. And since then, we started off one room in the health department, meeting on Tuesday nights with patients. We used to have as many as 50, 60 patients show up on that Tuesday night, make a line around the door. And as time went on, 4 years working out of the health department, we just continued to grow. And we grew so much, we said, okay, it's time to get our own place. And then we decided then to move over in 2010 over to where the Piedmont Regional Dental Clinic is now. And then we moved into half of that building and shared it with the dental clinic. And we were there for 5 years. And then we outgrew that space. And so in 5 years ago now, this September will be 5 years, we moved into this new place here in the Silk Mill. We're right next door to the Silk Mill Grill. So, you have lunch one day and come on over to visit us. But we are now in this space that we kind of designed ourselves. It was one big warehouse. And then we were able to go in and kind of design it. And we'll take you on a tour in a little bit to see what it looks like. But we designed it kind of to meet our needs and our growing needs at the time. And we're almost to the point now where we're kind of almost outgrowing this space too. So, but we're going to be here for a while. So we're not planning on leaving anytime soon. So basically that's kind of the history. We set up, and as it is right now, we're just like a regular doctor's office. We help people that don't have health insurance or are underinsured and are at 200% of the federal poverty level. So those are they have to live in Orange County as well. And so those are the requirements to be a member here at the free clinic. We have 2 providers. We have clinic every day, Monday through Thursday. And then Friday is actually, we're just open for the office. And we do all of our paperwork and our referrals and all of that stuff. But we, are just, like I said, a regular doctor's office. We see patients, We make referrals. We help patients with their medications. We help patients to, just have a better quality of life and get well and stay well so that they can, continue to work. Most of our patients are working. I know they use the term the working poor, but that's kind of what, where we are. Many of our patients work in the community and they're not offered health insurance. And so that's what we're here for, to make sure that we can keep everyone healthy.
Yeah. Are there any special qualifications or restrictions as to who can?
Once again, you have to live in Orange County, and have to be 200% of the federal poverty level, and we can't have health insurance. Now, what we've done is, when Virginia expanded Medicaid a couple years ago, we had some of our patients were able to qualify for Medicaid. And so if they did and they were already patients, we continue to see them to help with accessibility, because the problem was that once Medicaid expanded, a lot of the local doctors and doctors' offices could not accommodate our patients. And so we have most of our patients are chronic care patients that need ongoing, chronic care management. And they couldn't get appointments and couldn't go to other, physicians because they were booked. And they were saying that they couldn't get in for, 5, 6, 7 months. And of course, we couldn't just let our patients go that long without medical care. So we continue to grandfather to see patients that had Medicaid, but we don't bill Medicaid. We are a true free clinic. Our services are free.
Great. Well, let's take a look at the facility and
Sure.
Your design here and how it's set up. And then as we walk through, you can explain more about the different services that we have.
Okay, sure.
Right.
Okay, so when patients come in, this is the waiting room.
Okay, so this is.
And what we do is we have a partnership with an organization called Direct Relief. They're based out of California. And what they do is they send us a lot of overstock of toiletries and items for free. And we're able to put those on our shelves over here. We call it our free shelves. And we're able to put those products out. They're usually like cough medicines and aspirin and, shampoo and toothpaste, things like that. And then we're able to offer that. And many of our patients come in and, take advantage of that. As well as we've kind of grown into also having like a food table and a clothes table with COVID. It seemed like there were people who said, let me help you out in other ways. And we saw that people had needs besides medical needs. So we've actually put up a food table and a clothing table where people bring in items. And so we've got this little area here that's our free section. And it's amazing how many people come in on a daily basis, to see what's on the table and what's on the shelf. We have a local farmer. He's actually a Madison farmer. One of my nurses, her father, has a farm, and he raises chickens. And so she brings in, close to 100 dozen of eggs every week, fresh farm eggs. And we put those out, and people know to come here and pick up their eggs, on a weekly basis. It's kind of a neat little perk that we have. So anyway, this is our waiting room. When patients come in, they sit. We have a check-in area over here where Lisa sits at one window, and she's our check-in person. And then I usually sit at the other window with the check-out person.
Okay.
So when the patients check out, they usually check out with me.
Okay.
We do have a medical records, computer, so electronic medical records. So we do all of our charting and everything on medical records, as well as, real charts, the old paper charts. We keep those as a backup.
Okay.
Okay. So this is the waiting room. We have counseling services. We have usually a volunteer counselor that comes in once a week and meets with patients. And so this is the room that we use for counseling, as well as when she's not here, we use it for other forms of meeting with patients. Sometimes people just need help with filling out forms. We try to be helpful. We have some patients that can't read or write, and they have many forms to fill out for whatever purpose. And so we try to help them with that as well. So, and we come through the doors.
All right.
Welcome. I'm not sure if this is.
Yeah.
Okay. This is our nursing station. We have a nurse's office. We have 1.5 nurses. So one full-time and one who's here half day. And they're with us every day. Then we have 3 exam rooms. And exam room, they're exactly like regular doctor's office. So they're all the same.
Okay.
And we also do on-site labs here. We have a partnership with LabCorp, wonderful organization. They do all of our labs for us pro bono. And so we actually do our labs here. And so we provide, like I said, full doctor services. When the patients come in, they see their provider. We do their lab work here. We have an EKG machine that we do here. And if a patient needs x-rays, we have a partnership with Culpeper Hospital. And they do all of our x-rays, CTs, and ultrasounds for us pro bono, which is wonderful. They're a great organization. They really help us out. Then we have another exam room, 2 exam rooms.
Well, I have a question about funding.
Sure.
Was the intent of the expanded Medicare in Virginia really to put organizations like yours out of business? I don't mean that in a negative sense, but was that the intent?
I don't know if that was the intent. We, as a free clinic, we love what we do. We love helping patients, but we would love for everyone to have medical care.
Yeah.
So however they get it, that's what's important. That's the bottom line. When Medicaid expanded, again, it was from people who were at the rate of 0, making no money, to 138% of the federal poverty level.
Oh, I see.
There's still that gap between 138% and 200%. That's the vast majority of our patients. Our patients fall in that gap. That's what they call, we're filling the gap.
Okay.
They fall into that gap.
Okay.
So they don't necessarily, they can't get Medicaid, but they also don't have health insurance because they work at a fast food place that doesn't offer them any type of health insurance.
Right.
So they're the people that we're here mainly to help, so that there is no gap. And then you have the next level, of course, which are people that have health insurance.
Right.
So and no matter what, there's always going to be a gap of people that are not they make too much money for Medicaid and they don't make enough for insurance. Right. And that's what we're here for.
Okay.
And it's a big number.
Is it really? Okay. Yep.
Yeah. We're talking, about 9% of the population of the county, if not more. We find more every day. So.
Yeah, what are like the total numbers of people that you see throughout the year or whatever?
Well, right now, unduplicated on a yearly basis, we see on the average about 900, a little over 900. That's for medical. Now, if you're talking about people who come in to pick up medications, people who come in for help, other services, we can double that number. I hate to say it, but big numbers there. But as far as who we actually provide, who sees a nurse or a nurse practitioner or a doctor, that's about 900 unduplicated. Mm-hmm. Now that's thousands of visits. That we have about 4,000 visits a year.
Wow.
What we do is that we, when the patients come in, sometimes we've had patients when we first started that only needed a 1 or 2 time visit, for whatever reason. We've had patients that have been with us since day one. We are their primary care. We are their medical home. We have served and serviced well over 5,000 patients. That's how many charts we have up on our wall. So wow. They don't all, come every year. Like I said, sometimes they only come a few times. And then before they get before they get a job that offers them insurance, before they age out and get Medicare. Mm-hmm. So there are many reasons why they leave us. But for the most part, we've seen well over 5,000 patients.
Wow.
Individuals.
And of those 5,000, of those 900 annual, how many
Uh-huh.
are really diagnosed with chronic conditions?
I'd say well over, we usually say it's 75%
Yeah.
have some type of chronic. And that's, I'm probably underselling it, to be honest with you, because a lot of people, they come in and, we don't usually consider maybe allergies or things like that to be chronic, but they are. Because
Yeah.
they have to come in every year with something because they're just having a fit. Their eyes are running and their, nose are running. So that's probably underselling it, but at least 75% of our patients are chronic of some type. And of course, our number one is hypertension. High blood pressure is the number one, has been the number one every year. For my reports that I have to do every year as part of, we are members of the Virginia Association of Free and Charitable Clinics. And so we have reports that we have to fill out every year. And part of that is to put down what our diagnoses are. And we always have to list our 5 top diagnoses. And every year, the top 3 are always the same since I've been here.
Wow.
High blood pressure, diabetes, and depression. Those are the 3.
Wow.
And then 4 and 5, they vary from allergies to COPD, to asthma, high cholesterol. They kind of flip-flop around. GERD, that's a big one.
What'd you call it?
But GERD, GERD, like what you take Prilosec for.
Oh.
Gastrointestinal.
Oh.
Okay. Heartburn. Yeah. Chronic heartburn. There you go. But that's those are the ones that's what we see the most.
Wow.
But we see everything from people coming in with a ingrown toenail.
Yeah.
To stage 4 cancer.
That's right.
So there's nothing that we don't see. And they're our patients, and we help them, right on up through hospice sometimes. I hate to say it, but
yeah.
But that's, we are their medical home. And they love us. And, a lot of times the patient we say graduate out, that's what we call it, when they get Medicare or they get insurance. And we have to, fight them tooth and nail, they have to leave. They don't want to, they leave us, kicking and screaming. And many of them, which is kind of heartwarming, many people come back and visit even after they've graduated out. They come back and they bring us supplies and they bring us donations, and they come back and visit all the time, which I just think says a lot, because I don't think to go back and visit my old doctors, but they come by to visit all the time. On a daily basis, we see someone.
Wow.
Yeah, it's pretty cool. So anyway,
Okay.
This is the kitchen. This is what we've outgrown. We started off thinking that we were going to have, so much room in here, but we found that a lot of people bring us stuff and donate supplies. And okay, we had 2 closets, but the 2 closets don't quite cut it. But we have our board meetings in here when we have board meetings that aren't Zoom. And we have, our staff meetings and, staff luncheons and things like that in here. So, okay.
So you could use a little more storage.
We
maybe.
could. We have, like I said, the 2 closets, but that didn't cut it. And then here, like I said, we have 2 nurse practitioners that are here with us Monday through Thursday, and this is their office. Leslie Rayford and Kim Sargent.
Yep.
And they're wonderful. They've been with us pretty much the whole time we've been here, this particular site. We've had, others, but those are the 2 that we've had the longest. Okay.
Okay, let's
All right,
move on
follow.
around. So I'm going to take a picture of this scale right here because someone that you all know that's holding this camera comes and hides here to find out what he really weighs, so nobody else in his family will know the true number. So you can get a free weighing if you come.
Yes, that's true. And we actually have, I think it's pretty cool. We had a donation a few years back of a scale that, for an electronic scale, because sometimes we have patients that are a little over 500 pounds.
Wow.
And so this kind of scale, of course, does not accommodate that. So we actually have an electronic scale that will weigh up to 1,000 pounds.
Wow.
So things you don't think about, but.
Wow. Oops, sorry.
So in here we have,
This is the
yeah, one of
you
our
read this
major,
medication assistance
right.
program.
One of that, I would say that's one of our major services is medications. We all know how expensive medications are. And so what we were able to do, two cool things. For generic medicines, we have a partnership with Orange Pharmacy and Gordonsville Pharmacy. They have been partners since day one, before day one. And what they do is they provide medications at cost. So when we write prescriptions, if they're generics, patients can take those prescriptions up to the pharmacy. We stamp them. And then they have a $2 management fee for the patient for each medication. And then they bill us for the remainder, for the medication at the end of the month. And so that's how we provide generic medications. And that runs us, about $4,000 a month. We write the check for that. And then we have other medications that are like way expensive that we can't afford. And so we have a partnership with Virginia Healthcare Foundation, and they actually have a grant. And that's for our medication assistance program. We call it MAP. And then we have the grant pays for the two caseworkers. And they're in this room. And then what they do, they are the advocates for the patients they deal directly with the pharmaceutical company to try to get the expensive medications, insulin, inhalers, thyroid medicine, a variety of medicines. They get those medicines for free directly from the pharmaceutical company. And it's, there's a lot of paperwork involved. There's a lot of begging, a lot of negotiating, I guess you could say. But that's a wonderful program. And I would say right now, about $7 million worth of medication valued at $7 million we get a year that comes out of this program. So the medications, once we get the medications, it's delivered here. We bag it, we tag it, we store it in the cabinets here. And then we call the patient. Barry used to do that actually. And we call the patients and tell them that their medication's here. Come on by and pick it up. And then they come on and they pick it up, and it comes in 3 months worth supplies for 3 months. And like I said, that's ongoing all day long. We not only service our patients with this program, but we also serve the community. Mm-hmm. So you don't necessarily have to be a patient here to use this service. We have a lot of patients, for example, when they get on Medicare and they hit that donut hole because they're using those expensive medicines, they will come here, and for that time period, we can get the medications for them. We have recently picked up the Madison Free Clinic. Their program, the person who did this program there retired. And so they were like, they didn't have a whole lot of patients, but they did have some. And we said we would go ahead and help them out. So we've actually, kind of taken them under our wing, and we're doing their medication assistance program as well. Wow. So this is a growing program, and it's a fabulous program. It's unbelievable what we're able to get through this program.
Cool.
Okay.
All right.
Okay. And then we have, and you might ask, how do you keep the clinic doors open? Well, the clinic doors stay open because this lady in here. So Kim is our resource development person.
Hi again, everybody.
And this is her office in here.
As you can see, welcome to the Orange County Free Clinic.
This is where it happens here.
There, you don't have to show too much.
It's
It's somewhat of a mess right now. Been trying to organize it a little more. But again, welcome to the Orange County Free Clinic. And my office sits in the perfect spot because I hear a lot of everything that's going on, which is tantamount to my grants that I'll chat about in a bit, but helping the public and the community know exactly what we do, how we do it, and how important it is to not only the individual, but to the clinic and to our community. Because a healthy community always has to mean resources and sources that are provided to its citizens that may not have all of the resources that they need. And in fact, that's what poverty is all about as well, just not having those resources. So again, welcome to my office. as Doreen mentioned, what I do here is to help fund all of those services and programs that we're able to provide to residents who qualify. And I think we might have mentioned too that we do not accept, or we don't go after any direct federal funding here. It's all state, local, community, individual. I've been here almost 3 years now, and my job as I look at it is to make sure that you all know and the community knows what we do, that we're here, and that in fact these services are really important. So I spend a lot of my time working with the community, working with grantors on the phone, calling to ask and make sure that we're eligible for their grants, writing these grants, telling our story, processing funds that come in, individual checks, corporate checks, those types of things. Every year the board, Doreen, we set a budget, and based on what we've done the previous year and what we might need, we're a nonprofit, so it typically is right down to the wire. June 30th is the end of our fiscal year, and so we work towards that every single year. That's what I do, and I spend my time. And again, I listen for the stories outside so that I can make sure that everybody knows what we're doing. Spend a lot of time too organizing and developing, sending out pieces of information that might be helpful to the community, like our newsletter. We do this twice a year in November, typically in May. I'm working on ours now. Hopefully you all are on our list, and I can send you our newsletters. We have our postcard pieces, do a lot of outreach. Doreen probably mentioned that, I'm not sure, but we do a lot of outreach for new patients to come in, to let them know who we are, that we're here for their services. And, I send out postcards. I'm able to get a list of folk that are at a certain income level. We can send those postcards out, and hopefully, we know, in fact, they receive those postcards and they call in, or they hear about it, and they send it to someone that they know that might use their services. And and that's another really important piece of this, the advocacy of not only our board members like Barry. Oh, by the way, Barry's has always been, since I've been here, a huge help to me in regards to events, running around, helping me with newsletters and lists and just those kinds of things. And I'm a one-person office. Everybody pitches in, and Barry's just been great for that. But these postcards and these outreach things help folk know we're here and what we're doing, et cetera. So that's really important to the clinic itself. Again, processing. We're just spending our days making sure that people know about us, and that they stay with us, that they continue to donate. That's really important. Organizations like the Rotary, are important to us. We process that, and it does help.
Do you have a question, Jamie?
Yeah, my question is, how many of your donors are recurring, or do you have to continually write and attract new grant money?
We're a small organization. We have probably close to 200 what's called our individual or recurring donors, and this is on the individual side that I look at, and those folk continue to donate every year. The levels might change, but they're consistent, and I'm glad you asked that question. The consistency is important, but we do have to constantly work on that, and that's something I'm working on, some funding right now to help us to purchase a donor tracking software. We'll work on that and trying to do that, but that's something that's really important to us. I've got a good story about that. Maybe I'll tell you about that at some point. But yeah.
Since COVID and the pandemic hit, your usual fundraising efforts have been canceled. So tell us about one or two of the favorite ones that we can look forward to in the future.
Thank you, Barry, for bringing that up. Yes, we've had to cancel our signature event, or postpone it until another time. Our signature event, which is our Hope Blooms Gala. Typically, that brings in a huge amount of funding for us, or a large amount of funding for us every year that we use towards the next year. And that's our signature event. Hopefully we'll have it in 2022, the next year. It's usually occurring in, some of you might remember, it always occurred at Valentine's Day in the winter, etc. But we moved it to the spring in 2018, or 2019 rather. And hope to have it again in the spring when we do that. And our next event, our event, is our golf tournament, which is coming up October 1st. It's on a Friday this year at Meadows Farms Golf Course. We have great participation with that. Folk usually look forward to both events. So that's the one that we're trying to move forward with in October, and knock on wood, hopefully that's going to work out. I'm in the planning stages right now. There are sponsorships available. We'll be sending those out, information for players and the teams and that type of thing. So the pandemic, kind of put a crimp in our style. However, we're working on that and looking forward to those because they're so much fun. Those events are great. Barry's a big help with those events as well. So.
All right. Well, thank you. We're going to keep moving here.
Outside. Okay.
All right.
I think I'll join you all.
Yep, please do.
All right, well, we're pretty much at the end of the tour. Like I said, we're on electronic medical records now, but like I said, we keep our charts as a backup, and this is the chart room. And we kind of go back out to the ring room.
You took the shortcut.
I want to mention, Barry, our opportunities for funding. One of the things and this was established before I was here, but it is a naming opportunity, whereas donors, individuals can donate a certain amount, and the room is specially named for that
person,
for that individual person. This happened to be Sandra Speeden from Bill Speeden. Many of you might know him. We also have, again, oftentimes individuals will donate in memory of a loved one or someone that they just want to remember. So they do that to the clinic, send that donation in, and at a certain level, we're including those folk on our wall, our memory wall, which is here. And we try to include a plaque with those folk. And, you know, these folk are always very special because typically they have also been donors, consistent donors to the clinic. And, you know, this is a very special plaque, and we put that here in the waiting room for everyone to see as well.
Cool.
And Doreen might have mentioned the naming, the rooms of the nursing, our patient rooms are also, there's an opportunity to have a plaque put on the door in memory of. And we do have that.
Cool. All right, well, let's sit down just for a second and kind of wrap up here. So, Jamie, do we have any questions in the chat room?
No, but I see Ellen has her hand raised.
Hi, Ellen. Yeah.
Hi, both of you. This place is gorgeous. I'm just really, really impressed.
Well, we really want you guys to come out and visit us. Things are opening up now, so please come by anytime. We're here.
So
9 to 5, Monday to Friday.
That is one of the
it's sort of a dilemma. There are a number of us here who work at the food pantry.
Yes.
And we are packing up a lot of food that is very adversely affects one's health. So I'm figuring, oh, we're kind of creating patients for the free clinic here. But I guess, well, first of all, the question is, do you do nutrition counseling?
We don't do it, well, kind of, yeah. When the nurse practitioners, the whole idea of being a nurse practitioner, that's part of their, what they do, a little bit of everything. So when they sit and they meet with our patients, especially our patients who are, obese or have diabetes or just in general, they do sit and they do quite a bit with the counseling of nutrition. We have tons of patient education forms and things that we give out. Our nurses also meet individually. Nurses, not our nurse practitioners, but our actual nurses, they have special sessions with some of our patients to go over dietary education and needs.
Yeah, because it just seems like such a, chronically frustrating that, so many of the chronic diseases are kind of lifestyle based. And
unfortunately, we see that a lot because as we know, our patients don't have a lot of money. And so what they can afford is not always nutritionally the best. And so that's what we see. We see, they want to eat, they don't want to starve. So they tend to go with the easiest and the cheapest, which is not,
Not the healthiest.
not the healthiest.
yeah.
So that's this, the nature of the beast, unfortunately.
So when there are programs out there, and that's working with the community as well, we try to, part of our outreach is to work whenever we can with other nonprofits, other community resources to refer patients out to those folk if we possibly can. Those nutrition programs that teach and show. We're not able to track the success other than when there is patients coming back in and yes, the blood pressure is down, or yes, the weight has dropped off a bit, and it could be because of some of that.
We've actually had, and when COVID, pre-COVID, we have kind of a partnership with Heartland. I know you're familiar with Heartland, and
Yeah.
they're vegan and plant-based. And they've come in and they do nutritional classes and cooking classes and stuff for us all the time.
Oh, that's great.
So yeah, now that's again pre-COVID. We're hoping that now that we're starting again to open back up again, knock on wood, that we'll start that back up again. But we've had a long ongoing, since almost day one with them in doing that.
And now you're neighbors.
And they're our neighbors, and they bring stuff over all the time, actually.
Yeah.
Yeah.
So they actually bring stuff and donate to our table as well, the food table. So yeah, good partnership.
Great.
Fresh food.
I had one other completely unrelated question. That's about transportation. How do your patients get to you if they don't have
Most of our patients, either they drive or they depend on their friends to bring them over or their family. The Toot Bus is fabulous. For people who live in town, they actually bring them right to our door. They pick them up here at the door and they do, and bring them here to the door. They will actually go, we've had the Toot Bus like in Gordonsville that will actually go to the patient's house and pick them up from their doorstep, which is like unbelievable to me, but, and bring them here. So yeah, with transportation, it is an issue. And there are times when, we have to, say call your grandmother but they tend to do okay.
Good morning,
Great
Lisa.
event.
Good morning. Here is Lisa
Lisa's
coming
our
into
office
work.
manager. She's the one who keeps everything going smoothly here.
The question about nutrition kind of brought up another question for me. There are some other services that you refer to. I think you refer to them as in-kind services. Because when you mentioned earlier about depression being one of the main categories here, how do you refer people to other services like mental health and social services, dental services, that sort of thing?
Pretty much just like most doctor's office, but we use a referral system for specialty care, obviously. We have for mental health That's a tough one. Substance abuse, that's a tough one. We, obviously send people and refer people to RSCSB, Community Service Board. When people get Medicaid, we send them, try to give them a list of counseling services or in the area. And there's nothing really local, Culpeper, Charlottesville. We have numbers and, referrals that we send people to. We just kind of take everyone case by case, whatever their need is when they come in. Like I said, that little room right there is used a lot for us to sit down and just talk to people, and they kind of tell us what they need. So, but we were on the phone a lot, making calls and finding resources for people. That's also a big part of what we do.
What you do,
Yeah.
sure.
And outreach, I don't imagine you have the bandwidth for outreach, but how do you address that?
Outreach meaning to
So for instance, someone has a chronic condition such as diabetes or something like that. I mean, is there any outreach function within your organization, or do you actually hand it over to social services or?
No, usually we do as much as we can in-house. As far as outreach is letting people know that we're here, we put out, that's what Kim was saying, we put out lots of information as far as her postcards that target.
Yes.
We actually find addresses, and I was surprised I didn't know that this was possible, but that will target certain income levels of folks. We send that out. Word of mouth is unbelievable. I would say the majority of the people that walk in the door that come in seeking help of some type have heard from somebody else, that's kind of like major. We have our little sign on the bus. I don't know if you've seen the 2 bus, the Gordonsville one. We have our sign on that with our number. Outreach as far as programs and when we talk, people call, the phone rings nonstop. And when we actually talk to people, we let them know what our services are. They usually tell us what's going, what they need. And then we can, kind of send them in the right direction, or tell them, come on in and we'll work on it and do what we can to help them.
And it's surprising how if a program or service as is the clinic works well-oiled, oftentimes it's not thought of unless you need it. So many of our patients are coming in situations where they are more critical, and the outreach, as Doreen and as we've been trying to say and indicating too, it's important to us to make sure that folk know that we're here and that we're available when we're available. Our website is there, because people will Google, and it does come up with our website to give them as much information as possible. Again, we send out the postcards targeting individuals who would be eligible, may not know about us. And that postcard also says, pass this on, if it's not something that you need, or if it gets to a person that may not be eligible, pass this on. Talk to whomever, let them know that we're here.
And education is a big part of what we do here too.
Yeah.
Patient education is, it's key. And like I said, since we have nurse practitioners as our main providers, that just goes without saying. That's just what they're about. So, like I said, and that word of mouth. So once people know that that's out there, they bring in their family members, they, bring in their neighbors and bring in their friends, that they know that they meet in the parking lot and talk about, what their issues are. So, and then they say, yeah, going over to the clinic, we say all the time. Yeah, they'll help you out. They'll fix you up. We hear that all the time.
And that's the other thing about the clinic as well, and how we reach out to folk. There's a caring and a nurturing that you might not, Barry, you ask about, or someone asked about the services and how we refer, etc. I hear a lot in my office as well. There's a lot of going out of your way, taking that extra step that you may not but that you may not always see. And it's really important. there will be patients, and Doreen won't mention this, but they would have had surgery at 10 o'clock and they're calling Doreen at 5 or 4 to let her know, I'm finished, I'm done, you know, this, here we are. And, I'm still in the hospital. And it's that kind of relationship that I see that the clinic, everyone here, that they go that extra step and that they build, because it's not always, again, the communication, the education piece of it, that a patient, someone coming in, may not always have. There's barriers, communication barriers that we run into as well. And we do everything that we possibly can do to knock down those barriers so that everybody, when they're back in there with the provider, that they know and understand what's being said and how. We have a Spanish translator, interpreter.
We have a growing Hispanic population.
Yes.
We've grown from, since I started, 2% of our population to 19% of our population now.
It's huge.
It's Hispanic.
In the
And so to the point where we did hire we've always had a staff member who is bilingual, but we've hired an additional translator in the past year, especially since COVID started, to help us with translations. And speaking about COVID, so before time runs out, I do want to mention that we've been lucky enough to have a great partnership with the health department, the Virginia Health Department, as well as the local health department. And so we have actually been able to provide vaccination for the community, not just patients, but anyone in the community. They've asked that we do that, and we are happy to do that. We love doing that, actually. If any of you all are interested and you haven't had your COVID shot, your COVID vaccination, feel free to give us a call. We have a clinic going on Thursday.
This Thursday,
This
right?
Thursday. And usually it's on Thursdays that we have a vaccination clinic. So if you're interested, we'll be glad to do it.
I'm
We
sure
do the
we'll
Moderna.
all be interested in boosters.
Yeah, that's the next thing we're waiting to hear about. But yeah, so we are actually doing that. Like I said, we've opened up the clinic more when COVID first started. Of course, we closed down maybe for a week. The workers, staff, we've been here since day. We've not missed a day. But as far as our providers, they started working from home for the majority of 2020, doing phone visits, telehealth, meaning telephone, because not everyone has access to computers, many of our patients. But since April 1st of this year, we have actually started to bring everybody in. We were just doing labs, and after screening on the phone, we would let people come in and do nurse visits, and on some, things you just have to lay eyes on. So we've been doing that all along since day one. But now we're doing, 99% of our visits now are in-house again. With a few, if someone calls, they're saying that they have flu-like symptoms or COVID-like symptoms, we don't let them come in. We do their visit on the telephone. And then, tell them send them to go get tested. We don't do testing here. So we try to keep this a well site and not a sick site, if that makes sense.
Yeah. Do you feel like you're having any impact with the telehealth kind of movement that's going on these days, or your constituents probably don't have?
No, it didn't work. And we started off, we had a nurse practitioner had an app on her phone.
Right.
It was called Blue something, I can't remember now. We didn't use it very long. She tried, but so many of our patients didn't have access to a smartphone, didn't have a smartphone or internet, absolutely computers. So that didn't pan out. So, but everyone had a telephone of some type. So we figured out that using the telephone was the best way. And then after screening them on the telephone, then having them come into the office to be seen. So I don't see us necessarily going to telehealth, computer-wise, anytime soon. Yeah.
Then I only had one.
This is workforce, thank goodness.
I only have one more question, and that is, can you describe the intersection between your services and social services, or the Rappahannock health sector that we're in?
I absolutely say that we have a good partnership, a good relationship with them. It's, they do their thing, we do our thing, but the things overlap a lot.
Okay.
A lot of times we refer people there for, once they talk to us and ask us questions, we know how to direct them to where to go to seek that help. Likewise, they send people here all the time. Both of us and our CSB, they're referring people to us. We get a lot of our referrals that way. I hate to say it, but there are times when I have to call social services because we have some patients that need some adult protective services, and that I've garnered and they step right up and help. I mean, it's a good relationship. It's a good partnership that we have with all of the community services. Actually, I think when we need each other, we're there for each other.
Yeah.
I'll just echo that. Good morning, it's Crystal. And hey, Doreen, I would just like to say, Orange Free Clinic is a huge partner of ours, just doing, as we all know, amazing work. And I'm embarrassed to say I hadn't actually visited on site until today. And
you need to come on over.
I too just want to comment on how beautiful it is. And one thing I think is so important is like helping people feel welcome and worthy, and coming into a beautiful facility. I always say I don't want our lobby to look welfare-ish. And, I think that makes a big difference for folks feeling invited in. And your lobby and your facility obviously looks not welfare-ish. And I know that's not a proper term, but I'm just so impressed. Always have been impressed by the work y'all do, but it's so good to see y'all this morning. Thank you.
It's good seeing you. I was like, good seeing you, but please, everyone, Crystal and everyone, please come by and visit. It looks great, I'm sure, on
here come the donated eggs
on the computer, but in person, the woodwork, they did a wonderful job with the build out of this particular office. It is quite nice. We're real proud of it. So, it's clean and it's inviting and it's open and it's welcoming. And a lot of our patients, they recognize that, and it means a lot to them too. So, and we've had patients that have come in, new patients in particular, that have come into us feeling very, to use their word, embarrassed, which it just hurts my heart, but that's the way they feel, that they've had jobs, that they've had insurance their whole life, and all of a sudden through some sort of catastrophic accident or some sort of something where they've lost a job, lost their insurance, now, and they have chronic illness and ailment, they can't afford medications. So they see us as, as a resource for them. But they don't feel good about it at first. And I'm saying at first because I've never had one that a patient has come in that didn't feel great about us after they've actually come in. And they actually say that, is that, oh my goodness, this is the most wonderful place. I never want to go anywhere else. And so that's kind of good to hear. And that's it's great. And they say, I've been other places, nothing compares to. And so we're kind of proud of that we can, we can send that message and deliver that service and, be that clinic.
And, and that's that transitioning that some people have as well, from patient to donor, I have to say. And it becomes, another good point to say, the importance of the clinic and what we do for the community. Because again, you never know what situation you're going to find yourself in. Lots of job in this pandemic thing has been crazy. So, consistently I see that happening. I have one lady, an elderly lady, she doesn't need our services anymore. And she comes by every month with her check and donated and in-kind items. Every month. And she drives her little car up and there she is. And, we greet her and she has indicated, and she'll be in my newsletter as a matter of fact, that she wants to do what she can now because we were so helpful to her when she needed us, or when she needed us. So,
cool.
There we are. But thanks, Crystal, for that comment as well. We appreciate it.
Well, all good things have to come to an end once in a while.
And we've got patients chopping at the door here.
We have people knocking on the door.
I'm ready for some Dunkin' Donuts coffee.
Well, thank you so much for allowing us to visit and to learn so much more about your services.
And I'm serious, everyone, please come by. Just drop in. You don't need it, you know.
A special, yeah,
That's right.
a special invitation. Huh?
That's right. Just come right in.
And if you're not on our newsletter list, please give that information to Barry. I can get that from him. And again, we don't solicit unnecessarily. You won't see electronic e-newsletters, that type of thing. We do the hard copy so that you can put it on your table and you can read it when you have a minute to do that.
Super.
So we appreciate everything that you all do for us in the community as well.
All right. Well, thanks again. Bye-bye.
Thank you all very much.
Thank you, Barry.
Barry, you did a remarkably good job on that. Thank you so much. They were very, very interesting. We have reached the witching hour at 9 o'clock. I would like to thank everybody for coming today. It was actually a lot of fun. I see a Roy as a guest. Roy, I think, is the director of or the head of the board of the Free Clinic. Is that right? Do I have the right connection with Roy here?
Oh, no, you've got the wrong Roy. Roy's just a hanger-on.
It's Roy Jacobson, who I worked with very
Roy
closely
Jacobson.
last year. Hi, Roy.
Hello, Ellen. How are you?
Very well. It's wonderful to see your first name.
Well, thanks for being with us, Roy. You're always welcome. Folks, that's going to end it for the day. You will be hearing from me shortly. We have our first live meeting coming up on June 1. I think we have about 12 people who've agreed to come live, which is really nice. I'm just told yesterday by Ellen that our speaker is actually going to come and speak to us live, which is really great news. At one time, we thought that couldn't happen because of his schedule, but that's good. So those of you—
He is a live wire.
Say again?
He is a live wire.
Well, that's good. He'll be better live than virtual.
Yeah.
We will have the meeting on the virtual basis. We're working on the logistics of that. We do have some experience with group virtual meetings that we're working on, so it won't be, we're used to staring at a computer screen. This time we'll be sitting in a large room, but we do have some in another environment, some experience. Raymond does and I do. So we're working on the logistics. Thank you, Raymond. Get that done. We're considering the possibility of supplying coffee and donuts to the group that morning. We'll have that worked out we have a board meeting next week. We'll have it all worked out by the board meeting. We can talk about it then. So I'm looking, it's at the airport again. Buzz Jarrell has been extremely helpful. The meeting's going to be initially in the conference room, unless we get too many people to make it uncomfortable. And he said, just roll the TV out in the main room, and we'll have the meeting out there. So they're more than willing to work with us to see if we can get this thing off the ground. So again, thanks everybody. Good morning, Barry.
Thanks,
well, Barry must be in public because he has his mask back on. But
Yeah, a lot of people came in wearing masks, so I had to put mine on. I'm hiding in the counseling room.
Barry's trying to hide from us now. He's going in disguise, or he's robbing a bank, one or the other. So anyhow, thanks everybody for being with us today. It's a real treat. David, it's nice to see you with a smile on your face. We know you're getting better slowly but surely. He can now lift a bottle of beer up to his mouth without help. He's allowed to do that now.
And drive my car.
Yeah, he drives his car, but he can't mow grass yet at St. Thomas Church. If anybody sees him mowing grass, call the cops. He'll have a heart attack.
Yeah, he's well covered now. Thanks to Barry.
Thanks everybody. I'm going to log out, and thanks everybody for your participation.
Thanks so much, Barry. Fantastic job.
Good job, Barry.
You're welcome.